Well, I've been interested in Parkinson's disease for a long time. I had a very good friend who contracted the most aggressive form of Parkinson's disease. He was a great fishing buddy of mine and passed away a number of years ago as a consequence of the disease. This is a disease that affects so many people and really is just begging for a way to do much more precise diagnostics. To bring a new technology that we developed to the early diagnosis and stratification of Parkinson's disease. We have developed a method that allows us to detect proteins at a very low level, much lower levels than are presently detectable using conventional technologies. And as a consequence, we think by bringing this technology to bear on the problem, we have the ability, or will have the ability, to detect Parkinson's at a very early stage. One of the things that we've found in our work when we've developed these ultrasensitive protein assays is that the background levels of proteins vary significantly from individual to individual. This is in contrast to many metabolites. Things that people are familiar with would be metabolites like glucose or cholesterol, or the electrolytes like sodium and potassium. These are regulated at very controlled levels in our bloodstream as a consequence of just being necessary to coordinate our everyday function. In contrast, proteins seem to be, some proteins seem to be quite variable from individual to individual. And it's important, we think, to get baseline levels of individuals over time so that we can pick up changes in those baseline levels when adverse effects or disease onset occurs. Our work is really aimed at early diagnosis, and so we focus on trying to help patients, but I think there's going to be some interesting and perhaps broad applicability to furthering research in that we're looking in a concentration range for these proteins and other markers that have never been looked at before. And as a consequence, we think and hope that as we begin to explore these proteins, we will open up a whole new area for researchers to investigate new mechanisms or the underlying mechanisms of Parkinson's disease that heretofore have been invisible because we just have not been able to measure proteins at those levels. I think there's multiple areas in which our technology will be able to help patients with Parkinson's disease. First and foremost will be early detection. It's pretty clear, I think everybody believes and hopes that the earlier disease is detected, the earlier intervention can take place, and the better we can control the disease and its progression. So I think that would be, our primary goal would be really to detect early so that therapeutic intervention can be started immediately, and then we can slow progression. The other area in which I think there's a possibility that we'll be able to contribute is that many patients are just diagnosed with Parkinson's disease, and one can't know whether it's an aggressive form of disease or whether it's going to be a slow progressing form of disease. And so our hope is that we'll be able to also stratify patients so that we can pick up those differences early enough so that ideally the appropriate therapy can be administered and slow the progression of either of the many forms of disease. Our work is aimed at detecting disease at the earliest possible stages. We have a technology that allows us to measure particular kinds of markers called proteins that we hope will be very early indicators of the disease and will enable a much earlier diagnosis than would be possible using any available technology today.